At NovaGenix, we often get asked questions about a topic that's often misunderstood and frankly not discussed enough: menopause, and how hormone replacement therapy, or HRT, can help manage its symptoms. Menopause is a natural biological process that marks the end of a woman's reproductive years. It typically occurs in the late 40s to early 50s, though it can happen earlier for some. What's happening in the body is a significant decline in the production of a few key hormones: estrogen, progesterone, and even testosterone. These hormones play crucial roles not only in regulating the menstrual cycle, but in supporting many symptoms throughout the body. As estrogen levels drop, many women experience symptoms like hot flashes, night sweats, mood swings, sleep disturbances, and vaginal dryness. There's also a longer term concern: the loss of bone density, which can increase the risk of osteoporosis. Some women also report difficulties with concentration and memory, what's often called brain fog. Now, this is where hormone replacement therapy comes in. HRT works by supplementing the body with estrogen and sometimes progesterone to bring hormone levels back into balance. For many women, this can significantly ease the severity of symptoms. Hot flashes and night sweats become less frequent, sleep improves, and many find they feel more emotionally balanced. Importantly, HRT can also help maintain bone density and reduce the risk of fractures later in life. That said, it's essential to understand that HRT isn't the right choice for everyone. There are risks when taking any medications. So it's important to have an open, personalized conversation with an experienced healthcare provider like Dr. Mackey at NovaGenix. We carefully weigh the benefits against the risks and consider factors like age, overall health, and timing in determining whether or not HRT is right for a patient. The good news is there are options, and menopause does not have to be something women simply power through. With the right guidance, many women find that they can continue to live vibrant, healthy lives during and after this transition. Thank you for your attention, and remember, knowledge and open dialogue are some of our best tools for navigating through this stage of life.